One thing about reporting on all the latest research for multiple sclerosis is that I see an awful lot of stories that tend to fall into one of two categories. Either it sounds really promising and then you never hear another thing about it, or it sounds really promising and then the follow-up phase 2 trial or phase 3 trial or whatever turns out not to be everything that we had hoped. Now we've got Foralumab. Is that going to be any different? Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for almost 40 years. And we have been covering an awful lot of interesting research lately. Most of it doesn't seem to live up to what we thought. I was really excited about BTK inhibitors, for example, but they don't seem to be performing all that well in subsequent clinical trials. The same could be said of some of the other things that we've been looking at. But just yesterday, I saw a really good follow-up article on Foralumab, something that I've made a video about fairly recently, back in May. It is a nasal spray that they originally rolled out thinking that it was going to help with fatigue in non-active secondary progressive MS, which suits me to a T. But come to find out, 6 months down the road, they're finding that it not only helps with fatigue, but it does other things too. So we better take a look. Check this out. Yeah, I just saw this in Multiple Sclerosis News today. It was published on June 13th, 2024. Foralumab eases inflammation in 80% of non-active secondary progressive MS patients. Results came from PET imaging data from 10 patients who took part in an EAP. Well, sounds good. Let's find out more. They say that most patients with non-active secondary progressive multiple sclerosis who took Foralumab nasal spray for at least 6 months saw a decrease in microglial activity in their brains, according to its developer, Tiziana Life Sciences. The results were gleaned from PET imaging data from 10 non-active SPMS patients who took part in an expanded access program, or EAP, wherein patients with serious or life-threatening conditions have access to an experimental therapy outside of clinical trials. You might remember that from the last time we talked about this, that this EAP is making this available in advance of going through all of the clinical trials, although they have done the first phase, and the results, as you might remember, are quite promising. So now, in addition to the original very encouraging data around the improvement of fatigue, we're seeing that there might actually be some things going on at the cellular level that would help our MS. Microglia are resident immune cells in the brain that are believed to play a role in driving inflammation and nerve damage in multiple sclerosis. In the ongoing EAP, which includes 2 patients in single patient access programs and 8 in an intermediate-sized EAP, 80% of patients saw a reduction in microglia activity. That is really encouraging. I am thrilled that 80% of the non-active SPMS patients who received intranasal Foralumab treatment for at least 6 months have a qualitative reduction of microglial activity as confirmed in these latest PET images. Gabriele Cerrone, chairman, acting CEO, and founder of Tiziana, said in a company press release. Earlier data from the same 10 patients showed intranasal Foralumab stabilized or improved disability levels in all of them and eased fatigue in 70%. The U.S. Food and Drug Administration, or FDA, has allowed Foralumab to be administered to 20 more patients in the EAP based on the findings. So the FDA was quite satisfied that the safety profile was very good, and they felt very confident they could let others have access to this drug. Testing Foralumab for MS. Tiziana has also used EAP clinical data and animal model data to apply for orphan drug and fast-track designations. the latter of which has been accepted for review by the FDA. The designations are meant to expedite the clinical development and approval of the therapy. Fast Track status provides more frequent meetings with the FDA and discussions about the development plan, and, if certain criteria are met, enables therapies to receive priority review and accelerated approval. Orphan drug status is given to drugs that treat rare diseases and provides development incentives such as reduced regulatory fees and 7 years of market exclusivity if the treatment is approved. So there's the dollar incentive for Tiziana. They get to be exclusive with this product on the market if the treatment is approved, and so that's an incentive for them to invest. The progressive nature of non-active SPMS and lack of FDA-approved therapies for this disease aligns with the Food and Drug Administration's criteria for Fast Track designation. The increased interaction and partnership with the FDA afforded by this designation would be a tremendous asset to our Foralumab development program if granted, Cerrone said in another press release. Foralumab is an antibody-based therapy designed to reduce MS-driving inflammation by targeting the CD3 protein at the surface of immune T cells. This should block inflammatory T cell activity while boosting regulatory T cells that help keep the immune system in check. In the EAP, Foralumab is being administered into the nose at a 50 microgram dose. It's given in 3-week cycles consisting of sprays into each nostril 3 times a week for 2 weeks, followed by a week without treatment. After the promising findings in a patient population with few treatment options available, Tiziana launched a phase 2A trial, and there's the number, we'll be looking at that in just a moment, to evaluate the treatment in a placebo-controlled setting. In the trial, 54 patients with non-active SPMS will be enrolled and randomly assigned to one of 2 Foralumab doses, 50 or 100 micrograms, or a placebo for 3 months. The main goals are to determine its safety and changes in microglia activation in PET scans after 3 months. Researchers will also look at disability and fatigue outcomes as secondary goals to confirm the benefits observed in the EAP. With the allowance of an additional 20 patients in the EA program, the application for orphan drug designation for non-active SPMS and the ongoing phase 2A trial, Tiziana is rapidly progressing its intranasal Foralumab program in multiple sclerosis, Cerrone said. Well, that's really, really interesting news, isn't it? And it's so late breaking, you even get a chance to participate in the clinical trial. We'll just take a look at a few parts of the clinical trial that's now recruiting. I'm only going to do screen-by-screen shots here because otherwise I think the print is going to be way small. But here's the title of this study, A Study of Nasal Foralumab in Non-Active Secondary Progressive Multiple Sclerosis Patients. And so you see the clinical trial number here, and it's Tiziana Life Sciences Limited. The last update was just in March of 2024. And looking just very quickly here at the study overview, we see that the primary objective of this particular clinical trial is to determine the safety and tolerability of 50 microgram dose and 100 microgram dose of Foralumab nasal compared to placebo. So as we remember from the article, there'll be 3 different groups. There'll be one at 50 micrograms, one at 100 micrograms, and one placebo. So you have a 1 in 3 chance of being just in the placebo group. But fear not, even if you're only in the control group, it still does a lot of good for the eventual reliability of the data that comes from the trial. We won't go through the detailed description because I don't really think it's significantly different from what we've already seen. And the study start date is November 15th of 2023. That's already in progress. And the completion date, estimated completion date, is November of 2024, so coming right out. Coming right up. And the study completion estimated is also November of 2024. So we are booking right along. And the estimated enrollment that they're looking for is 54 people. It's an interventional study phase 2 trial. This piece you'd find important, the contacts and locations. The study contact is Matthew Davis, and there's his phone number and his email, and the backup is also listed there for you. So if you want to go ahead and contact these folks, you can do that. And as far as locations go, this is coming out of Boston, Massachusetts, out of the Brigham and Women's Hospital. So there's another contact name for you right there. And then you'll see down here the principal investigator is Dr. Chitness, and remember in my last video about Foralumab, I played a bit of an interview with him. And then, of course, you're going to want to look through the participation criteria. These are always important. I'm not going to go through this in detail right here because I think you need to look at these for yourself. If you're interested, go ahead and take a look. There's a lot of criteria for eligibility, and there's also criteria for exclusion, and you might want to look at that too, because there might be a reason why, for some reason or other, you're not able to participate in this study. So don't call them until you have had a chance to go through these and be pretty honest about whether you think you would be eligible for this trial. But here's another exciting piece of information. The ages eligible for study go from 18 to 75. I appreciate that very much because, like I said, a lot of these studies don't actually recruit older people, like above 55 even. And certainly going up to 75, that's almost unheard of. Well, okay, I try really hard not to let myself get too excited about things, but I have to say, I'm pretty excited about this one. I sent all of this information to the neurologist who's heading up the clinical trial that I'm involved in at Oregon Health Science University in Portland, just so that she would know about it, because when I mentioned it to her the other day, she had not heard of it. I think that it's not getting the airplay that it really should, because this, if it's true, is going to really change the game for a lot of us who've been living with MS for a long, long time. And we've been told over and over again that, well, remyelination isn't going to really help you, and these kinds of therapies aren't really going to do you much good, and you're too old for this, and you're not in the right stage for that. All right, well, here's something that's just for us, and it's actually going to work, I think. It's certainly looking good. I'd love to try it, and I imagine you might too. Several of you said so last time in the last video. What do you feel now? Are you more excited about it? Are you the same? Or are you just thinking, this still sounds like it's too good to be true? Let me know. I'd love to hear from you. But that's all I have for you today. So until my next video, please do take really good care of yourself.